Hi, class. My name is Lisa Graff. I wanted to introduce myself. I've been a nurse for over 6 years, all within the hospital setting. I work at Rhode Island Hospital in Providence. I first started on neurology for 2 years, and then I moved on to the medical surgical psychiatric float pool. And from there, I transitioned into a per diem role in psychiatry exclusively. My hope is to graduate this time next year with an NP, with an MSN with a concentration in psychiatry and mental health. I am motivated and inspired by my experiences in the inpatient setting, where I see some really treatment-resistant patients, but also patients ultimately not getting what they need to have the most successful treatment and outcomes. So ultimately, when I graduate, I'm hoping to work in the private practice setting so that I can develop some therapeutic relationships with patients, really dive into treatment and including therapy in the hopes that patients can have happier, more productive lives and not necessitate admissions in the acute setting, where oftentimes it's really just a matter of prioritizing safety rather than true management, of, day-to-day function and life satisfaction. Throughout school, I've used a number of strategies to stay successful. One of the things I've done that has worked for me in the past, I use the study guide that is oftentimes provided by the professor, and I start diving into the main themes early in the week of an exam. I actually create, a really in-depth study guide to review the main concepts and the ideas that the curriculum sort of suggests they want to hit home. From there, if the chapter has questions at the end, I will often reference those to seek out the answers. I find this is a really good way to study for exam questions as practical examples of what we may see. I also don't cram, really. I don't find that works for me. I know everybody's testing strategies are different, but I find that if I study in segments, that has been one strategy that's been effective. As far as how I relax during the semester, I will usually turn to the things that I enjoy the most. I watch funny movies, I take walks, I enjoy being outside, I enjoy spending time with my friends and family and my husband. And also I do some deep breathing exercises, actually, usually several times a week, if not more. I find that it helps me lower my resting heart rate and just to feel a mind and body relaxation. Especially in those weeks where we have a lot of assignments, papers, and studying to do. I find that the deep breathing is very effective. I want to wish you all the best of luck this semester. I look forward to getting to know you, and I wish us all much success. Thanks.